Hi there, I am Gabriel Ling. Today I would like to share with you a study titled Factors Influencing Asia-Pacific Countries' Success Level in Curbing COVID-19, a review using a socio-ecological system framework. So we try to look at this COVID-19 abatement level or severity level from the angle of socio-ecological system. And it is more of an NPI or non-pharmaceutical intervention approach. Through the study, we believe that it can offer some insightful view in terms of why and how certain countries can abate the pandemic more successfully as opposed to others. This framework is a variable-oriented or process-oriented system where it can offer quite interesting insights and views to policymakers towards a more informed decision, in this case, how to manage or abate the COVID-19 pandemic more successfully. Meaning, based on these attributes or factors, for example, in this case, resources, governance, and actors, how these factors all together interact with each other in reality, how then those factors affects the outcome. In this case, the outcome has been measured based on the cumulative cases. So I believe that each factors or sub-factors here affects the COVID-19 and how that mixed together to define stringency index and other indexes. So the study areas involved were 7 Asia-Pacific countries, and the time frame of the study covered was from 1st February to 30th June. So since the study mainly used secondary sources from official government reports, scientific journal articles, as well as some websites, those secondary data were content analyzed, and to make it more quantitatively presented, codes have been assigned and have been described, meaning those attributes and sub-attributes have been assigned using these codes like absence, partially absence, and presence. We believe that the higher the number in terms of presence, the better it is for the country to abate the pandemic. And as opposed to it, the higher the number in terms of absence for the variables, the worse it is for the countries, meaning the countries may not be successful in curbing if there is high numbers in terms of A for those variables. So to make sure that the coding process was reliable and consistent, kappa was measured, coherence kappa was measured using SPSS. The result shows that it is more than 0.75. So it is indeed reliable and consistent. So this is the results and discussions for this. Now, as mentioned, across 7 countries, all these sub-attributes have been measured, have been given codes PP, P, and A. The first page here is on the community. The second one will be the physical, and last one will be the governance. So altogether, it has about 13 sub-attributes measured across 7 countries, given those codes PP, P, and A. So to some, Indonesia and Japan, surprisingly, they perform not really well. It shows that there are only very little P's and with a lot of A's, quite a number compared to other countries like New Zealand, Singapore, as well as Vietnam. So this it kind of has been reflected in the very kind of low index, and because of this low index and high number in terms of the present, it kind of reflect quite relatively high in terms of this number. All this situation explain why Indonesia, Japan have a lower success rate in abating COVID-19, whereas for New Zealand and Singapore and Vietnam, they have kind of quite high success rate in the abatement of the pandemic. So there are several key takeaways. Although countries possess high number of Ps, it does not necessarily guarantee that it is successful in abating the pandemic. Some attributes, mostly from the government, may carry higher weightage in explaining Therefore, we believe that this study can give some insights to the policymaker in managing the crisis more effectively in the future. Thank you very much.